Good afternoon, class. My name is Sanchia, and today I'm going to be demonstrating how to administer antibiotic 3 milliliter intramuscularly. So first off, I've already verified my patient and I've already verified my order. So now I'm going to prepare. So next, I have all my supplies that I'm going to be needed. I'm going to perform hand hygiene, and I'm going to start setting up. So I like to put gloves on because once I enter a patient room, I never know when I might come in contact with body fluid, so I like to put my gloves on, okay? And we're gonna be using a septic technique to prepare, okay? So my next thing, I have my antibiotic, and I've already checked to see that it's not expired. I have my syringe. I have my needles. I have my gauze. I have Band-Aid. Necessarily, this is not a must, but I have it just in case I need it. And also I have extra gloves. So my next step is I'm gonna set up. I'm gonna grab my syringe and I'm gonna attach my needle. Okay. I'm gonna grab my valve, and I like to clean the top of my valve before I inject my needle in it. So I'm gonna clean the top. Okay. After we did that, now we're gonna pull back, which is called aspirating, just to get rid of the air. So we're going to be administering 3 milliliters. So I'm going to be pulling back, as you could see, 3 all the way up. As you could see, 3 all the way up right here, and there you go. Okay, 3. So we've already done that. My next step is I'm going to remove my needle cap. As you can see, I'm going to grab my valve and I'm going to inject and get rid of all the air from the syringe, okay? After I did that, my next step is I'm gonna invert and I'm gonna pull up my medication. So 3 milliliters again, we're gonna go right here. We're gonna pull all the way up, 1, 2, 3, all the way up. And then you could see right there, 3 milliliters. There we go, okay. I'm gonna remove, and next step is I'm gonna remove this needle, but normally we don't recap needles, but for this demo I don't have a safety cap, so I'm gonna recap using the one hand technique, which means you keep this hand free and you're gonna recap using the one hand. There you go. Remember, we don't normally recap needles because it's very dangerous, but for this technique I do not have a safety needle, so I did the one hand technique. So my next step is I'm going to remove this needle. Why? Because I've already used this needle to aspirate and pull the medication, and that it might be bent at the top, and if I use this might damage my patient, so I'm going to change it. Here we go. We're going to remove it. I'm going to grab a new needle. Here we go. And then we're going to attach, so our medication is ready to be injected in our patient. So my next step is I'm going to remove this gloves, this guard, perform hand hygiene again, and I'm going to apply new gloves. All right, fresh gloves. So my next step is locate the area that you're going to be using. So because I'm giving 3 milliliters, I prefer to use the ventricular because that's more space, and normally in the deltoid you apply up to 1 milliliters. So I'm going to be using the ventricular. Okay, here we go. After I located my site, my next step is I'm going to open my alcohol pad again, and I'm going to clean the air outwards in circular motions up to 2 inches, okay, or 5 centimeters, okay. After we did that, do not blow on it, let it dry for a few seconds. Okay, I'm gonna grab my medication and I'm ready to inject. So intramuscular injections we apply at a 90 degrees angle. So 90 degrees angle for intramuscular injection. Okay, so what we're going to do, we're going to use the Z-trap method, which I'm going to remove my needle cap. My bevel is up. And for the Z-trap, you're going to pull to the side with the other end just showing. And we're going to inject. So 90 degrees angle would be at this, okay? And we're going to inject. Okay, so while we inject, we're going to aspirate a little bit, which is pulling back the plunger a little bit. And so when you aspirate and you see, once you inject your patient and you aspirate and you see blood coming up, you have to remove and start over. Once you insert your needle in your patient, 90 degrees angle, and you aspirate a little bit, as you can see, pull it back a little bit, and you see blood, you have to remove and start over, because that means that's gonna be dangerous. That you have to remove and start over, because that means you're not in the muscle, you're probably in a blood vessel. So you want to remove that, and just to make sure. Okay, so let's pretend again. We inject, we aspirate, we don't see no blood. Now we're gonna push and we're gonna inject our antibiotic. You're gonna go 10 seconds for every 1 milliliters. 1, 2, 3. Continue, push, push, push. Continue, continue. Once you have finished, you're gonna remove and you're gonna apply gauze, and you're gonna discard both needle and syringe in sharp container. Okay, apply slight pressure, do not massage, slight pressure. And if necessary, you could apply a band-aid if you think it's necessary. Okay, so after we have done all this, discard everything, I'm gonna remove my gloves. I'm gonna perform hand hygiene, and then I'm gonna document. So as it relates to document, you have to document what muscle you use, what side that is, how the patient react, the amount of medication, and that's pretty much it. You have to document. Once you finish with your patient, make sure you document immediately, okay? Once you have done all that, you get back your patient in a comfy position again, clean up, and hygiene, and then you remove yourself. And that's how I perform an intramuscular injection. Thank you.